physical therapist on the internet.
Hi, folks. I'm Bob Sharp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, we're going to talk about, is it a blood clot causing the pain in your leg? DVT, which is a deep vein thrombosis, clot. And we're going to tell you how to tell it and how to prevent it.
Right.
So let's get to it, Brad. There's two common places one may feel pain from a blood clot in your legs. One is your calf.
Yep.
And another one is right behind the knee or the thigh.
Sure.
Right in this area. I haven't seen any of those. Have you?
I don't think so. The calf is probably
Really more common.
dominant.
Yeah. So what you're looking for, some common signs of a DVT is, or a blood clot, is you might feel cramping or throbbing in the calf muscle or behind the knee or thigh, and it's usually just one leg.
Yeah.
It'd be unusual to get a blood clot in both legs at the same time.
Because you can feel pain and cramping from other things, so
Right.
you can't. It's just one of those things that you have to be concerned about, but
Yeah, like
whatever.
what they call claudication, where your arteries are narrowed up, and when you walk, you get pain in your calf from that too.
Right.
But that's both calves. Yeah.
My father had that very clearly. He could walk shorter and shorter as he got worse and worse, and it was as a result of the arteries being
Right. And the same holds true for swelling, Brad. You're going to get it in one leg as opposed to two legs. So there may be swelling in the calf or behind the knee.
You mean with a DVT or
with
the
a
clot?
DVT or clot, right. The skin may feel warm around the painful area. The skin may be red or discolored around the painful area. I've seen this after knee replacements where it's gotten red and discolored.
Yeah.
So then we're also going to show you how to do one test called Homan's test. Now, Brad and I were just talking about this test. It's by no means always accurate. I mean, you may get a false positive, but I have found several in my career of people that had a DVT when I did a Homan's test.
Sure.
And, basically, Brad, if you want to do it on me,
okay.
I can just put my leg straight like this,
Yep.
and you're going to dorsiflex.
Yep. So if you dorsiflex or do a stretch like this, that will cause pain. And now, do you normally dorsiflex and squeeze at the same time? And that's why it's kind of hard to do this without a second person. And then you're going to squeeze here, and it's going to be real painful. This is one of those things where, like Bob said, even a skilled person may have a positive test, and I always send them in and get it checked out. A lot of times they come back and they don't have the clot, but you want to get it checked out because if it is, it's important.
I got to the point where I would, if there was swelling, there pain, and maybe some redness, then I definitely would have them go in. Sometimes if there was just pain, I'd kind of watch it, and I'd mention it to nursing all the time.
Right.
So, and they could decide too.
If you're at home by yourself and you're watching this and you do it, especially if it seems like it's getting worse, you need to go in and get it checked out for sure.
Because the DVT is dangerous. The blood clot is dangerous. So it can break loose and travel through your bloodstream and get stuck in your lungs.
Yes.
So I always brought up the example. It was during the Iraqi war, Brad. That one reporter, he was in a tank for several hours. I think like 12 hours.
Sure.
And he got a blood clot, went up to his lungs and killed him. He was a young guy.
Yeah, young and healthy.
Right.
So and that's it's nothing to just blow off.
So we'll give some examples when you're likely to get a DVT or a blood clot. After an operation, because you're immobile, and if you're on bed rest,
right.
Again, immobile. This is the one that, for the average person, they may run into if they're on a long trip in a car or a plane or train, especially a plane, because you can't move much.
Right.
You can't get up and walk as well as you would like to.
Especially if you're in by the window, it's really awkward, so you kind of stay there unless you really got to go.
Yeah. So greater than 3 hours. If you're pregnant, or recently had a baby.
Okay.
If you're dehydrated. So
Yeah,
that's another one.
and a lot of people are dehydrated
Right.
without even being aware
Realize
of
it.
it.
Yes. So who's at increased odds for developing a blood clot? If you had a previous blood clot, and I remember patients like that, they've
Sure.
had them before.
Yeah.
In those cases, if I found something, I would definitely send them in because they already had a history of it.
Yeah.
Yep.
Mhm.
If you have varicose veins,
Yep.
if you smoke, if you take contraceptive pills, if you are on hormone replacement
Okay.
therapy, if you have heart failure, if you are overweight, if you have cancer. So there's a lot of them.
Yeah, and they're all kind of related, and
Right.
and it is one of those things that this fits a lot of people
Right.
that don't have any symptoms at all because
Right.
of whatever reason, whether it's lifestyle or situational.
So how to prevent DVTs? One thing, when I'm on a plane, I'm doing ankle pumps. So you
try and
just,
keep things moving.
yeah, and if you're listening to this on a podcast, all we're doing is bringing our toes up and
Yeah, just
toes up and down.
I know they can't see this on the
Yeah.
podcast, but maybe some viewers wanted it a little more clear. But you're going to do 10 to 20 of those at a time,
Yep.
every 20 minutes or half hour.
Yep. And try not to sit for long periods of time, even on a plane. Try to get up at least every hour and upset your plane mates.
Well, hopefully, if you
You're
get an
getting up
aisle,
again?
yeah, but you can request an aisle seat
Yeah, aisle seat.
when you're getting your seat would be helpful.
And the ankle pumps will help too. Drink plenty of fluids,
Right.
which is not bad. You don't
Water.
you don't like to do that on a plane, Brad, because then you
Yeah,
gotta go to
then
the
you gotta,
bathroom.
yeah,
So do not cross your legs. That impedes blood flow and it
right,
could
sure.
lead to it. Do not smoke, which
Most people understand.
yeah, and don't drink lots of alcohol.
Right.
Brad, you're in trouble.
Well, it's tough when you live in Wisconsin.
Yeah,
Bob.
that's right.
We're going to have Wisconsinites getting mad
Yeah.
at me.
Well, they know.
Everybody know.
Minnesota's not far behind.
Yeah, but it may be exaggerated a little.
So treatment is to have some type of anticoagulant medicine. They'll
Sure,
put you on,
right, the doctor will
blood thinning medicine.
prescribe.
So very easy to prevent and also to stop.
Right, if you have one, the treatment is typically medication.
Right.
And there's maybe modifications on your activity per the doctor's discretion.
For a while, for a short while.
Right, yeah. But typically, most everyone that I've had over the last 20 years with a blood clot has come out of it without problems.
I've never had one that went to the lungs, I don't believe.
Right. You get them afterwards
Right,
sometimes.
I get them afterwards sometimes.
People
right.
that didn't catch it early enough.
Yeah. All right, thanks. Check out the rest of our videos on knee pain, which is at bobandbrad.com. Go to the program section.
That's right.
Do you want to say anything else about it?
Well, if you go to the program section, click on the video. There will be 30 or 40 videos on the knee. Look at the titles, pick out the one that pertains to your question. Watch the video. On the right-hand side, there'll be a PDF. You can click on it and get a printout with a
Right.
review and exercises on the printout. So it's very convenient. There's no charge, not even an email. So we
That's
wish
right.
you well.
It's our gift to you.